Good day. I would like to welcome you to listening on my interview with Dr. Jose Cruz Chavez. Dr. Chavez describes elder care as a blur. This could be due to the overwhelming medical needs of his mother, as well as the change in family structure as he took on the lead role after the passing of his father. During the interview, we also talked about the status of his mother's care and whether there's a need for additional services or reassessment of her healthcare needs to expand the services provided. Thank you, and please listen in. Welcome, Dr. Cruz Chavez.
Hi, thank you. Thank you for having me.
Well, it's really a pleasure. I'm looking forward to our discussion. As we talked about, this really has to do with elder care, what families go through, and to really hear about your story and your experience taking care of aging parents, right?
Yes.
Before we begin, can you just give me some brief demographics about yourself, age, race, gender, occupation, and proximity to where you live?
Right. So, age 46, I consider myself Latinx in the Latinx community. I live in central Jersey, New Jersey. What else?
Occupation.
Occupation. I actually am a senior program coordinator for the Graduate School of Social Work at Rutgers University.
Okay, excellent. So let's get into it. Tell me about your experience with taking care of your parents.
Oh my gosh. Well, it may seem like a blur at one point. It may seem crystal clear at another. It's full of different experiences. And I think navigating the different systems, understanding there's a lot that you think you don't know, and the stuff that you don't know, you're like, what is this? So it's very complex. There's a lot of players, a lot of different staff members you have to speak to, a lot of different ways of getting to your goals and objectives. Speaking to nurses, speaking to different staff, not just a medical provider, but also using so many of the other staff, support staff that's around. So obviously social workers and individuals that can help you. But I want to say it's been a very interesting ride, and it's been almost, I want to say a blur right now, because actually just recently I had my mother as elderly and I had to take her to the hospital. This is the second time within the last couple of months, and she just got home today. So this up and down, you're good one day, you're not so good another, you don't know what to expect at night for a phone call. So it's a lot. It's a lot. Needless to say, it's a lot.
Yeah, so what I'm hearing is a lot of the burden family face while caring for an aging parent who may have different types of conditions that require acute care, hospitalization, and constant follow-up, and having to sort of juggle your full-time responsibility as a senior advisor. I mean, that's why we're here, right? That's what we want to talk about. So let's dive into this a little bit further. So why don't you share with me an example of the challenges that you're facing? You talked about your mom. How long was she in the hospital for?
So this time around, she was in the hospital for about 2 days.
Okay.
Yeah.
And sort of overall, how was that experience for you and your mother navigating the healthcare system?
Well, you are working with another human being. So my mother, she still makes a lot. Wants to make different decisions sometimes. So if the physician says, okay, great, you're here, you're at the hospital, this will take a couple of days, and you let your parent know, I let my mother know, and she's like, a couple of days? Why? I don't want to stay here. So it's not only navigating, it's different. Obviously, she's going to have a voice in her care.
Right.
So we can plan it out with the healthcare provider, but it's also about getting everyone on the same page.
And
so
how do you get her on the same page? How do you go about doing that? Especially something that she's against. What's that?
You do your best. You do your best. You explain it. Actually, what has helped, I have been able to call on extended family. And that sounds a little bit like, oh, why didn't you? You also consider, for example, my mother's a very private person, so she doesn't communicate everything that's going on to extended family. But when extended family can be brought in to explain things to support what you're trying to say. We also have another healthcare provider in our family, so they also call and they explain things. And sometimes it works, and sometimes it doesn't. So it just, you keep trying. You do different providers, you bring different people in to explain things to them.
Yes, thank you for sharing that, because the family dynamics is such a huge component that's often misinterpreted, misjudged, overlooked, underestimated in the decision or the outcome of the care, right, of an elderly parent or a loved one. And I find that to be one of the major underpinnings to sort of dictate how things are going to unfold.
Yes. And also to remember that different people in the family have different histories with this individual, right? They have different experiences, they recall them differently. So they may, it's not just a question of like they need assistance, everyone kind of come in. It's each person has their own relationship with the individual that's being cared for. So that has to be also considered. Some people would be very happy to step in and others may not be.
Yes, that actually is a very good point. And I found that to be the case with my family and every other family. I don't know, a family that may not, well, actually, I take that back. There are some circumstances where the adult kids really did get together and there was this really teamwork and advocacy. And then the flip side is you have families that, like you said, you have a history with that you may or may not get along or may have an argument with, and they may not be there to support you or your parent. So as you talk about your mom, and she has a say, and rightfully so, and if you don't mind me asking, how old is she?
She's 84.
Okay, so she's 84 years old. And how do you go about sort of planning for, say, in the event that she does not, she's unable to have a say and she can't make a decision about her care?
Right. So, I mean, I have had conversations with her and providers and just getting the documents in order of being able to make decisions, right? Which the name of it is escaping me now, but it's usually the document that
Healthcare proxy?
Yes.
Yes.
So that all that's in order. We have also discussed her wishes and what she would like to do. And my father passed away about 5-6 years ago. And so basically I oversaw that whole transition and she, reviewed it. And then she said, that's exactly what I would like for anything. If something were to happen to me, this is the trajectory that I would like you to follow to.
So these systems in place, you talked about the healthcare proxy, but that's just the tip of the iceberg. What about issues of will and DNR, do not resuscitate, or power of attorney?
Yes, so that is all done. We went to an attorney, and they drew up the will, and they drew up all the other documents. But yes, the DNR, that's all also set.
Wow, that's fantastic. It's really great to hear that more and more people that I interviewed thus far, those who are interviewed have their ducks in order, so to speak, or at least getting there or on the road to get there. But I want to go back to 84 years old and your father passed away. So what is that like? I mean, your mom, you said she has recurrent bouts of illness. And who's there to take care of her? Who's there to watch her? She have 24-hour care? Or what is that like?
Right. So she does have an aide that comes in about 12 hours a week. And my sister lives with her, although my sister also has health issues, mental health issues.
Okay.
And so it's very limited what she can do. And then I step in. But right, when my father was living, he was a little bit more, he would try to help a little bit more.
Sure.
And so as he passed away, I've kind of stepped in to kind of basically help and assist.
Okay, so I want to get into the sort of the weeds, if you will, about aid. And I know that's very restrictive, it seems, right? And especially as I'm hearing from you, she has medical conditions that causes hospitalization, right? So it's sort of, she requires medical supervision, right? Observation, etc. So How many hours you said the aide is there for?
12.
Right. And your sister's already, she's also, medically compromised as well, right? That may require
Exactly.
help. So 12 hours a week, right? So how many hours a day?
So about four for 3 days.
Okay. So I would imagine she's probably qualifies for some health insurance that would allow her to get her the aid, correct?
Right.
Okay.
Right. That is a coordination that has to happen. The coordination with the physician that writes how many hours or supports the number of hours, and then the insurance company to say yes or no, or
and then the insurance company comes and do their own evaluation as well.
I believe they do send a nurse in, yes.
Yes, to do an assessment. So, because we went through that with my mom, actually. So, I guess the question is, do you see the need for extended hours? And the reason why I'm asking that is because,
Yes.
okay, all right. So, in my previous interviews, and even from my own experience, to have those extended hours requires a bit of advocacy. Because what I'm learning is that the health insurance companies, the home health aides, etc., they don't really, they are just there maybe an hour or a few minutes to do an assessment.
Right.
They are not there when you have to be there wee hours in the morning every day to do the additional legwork